Hi and welcome all you trained therapists. I'm just going to take you through, and I know you already know them, but I'm going to share a couple of things that maybe you don't know or may help you, but it's important that we do go over the contraindications. I know, I can hear you know them all. Okay, well, especially when I get to inflammation, I'll just share a couple of things that maybe you don't know or maybe you haven't tried before, or give you something else to think about. So we're just going to go through them quickly, and I know, as I said before, you know them, but it's just part of putting this course together, of being thorough and yeah, just reminding you again, because we can't be reminded enough, can we, of the things that we need to be aware of. So, yep, here we go, and let's see what we can help you with. Maybe there's some things you don't know or forgotten. So as we start with the contraindications, as you know, it's important that our aim is to help people, not to make them worse. So it's important that we take note of the contraindications. And I know as trained therapists, you're already taking records and getting doctors' feedback and all that sort of stuff. And yep, but here we go anyway. I'm going to go through them fairly quickly for you. And a couple, I might spend a couple of seconds just to share some things from my own experience that may help you. Hopefully it does, and this has not been a waste for you. So here we go. Abnormal body temperature. As you know, that someone with abnormal body temperature, all we're going to do is increase that temperature, so we're really not going to help with our massage. So that's, as you know, is contraindicated. The second one is allergies and skin conditions. And yeah, you would have heard from the client that, yeah, that's okay to be massaged. But one thing I do or did, when someone had an allergy and they said, yeah, look, it's okay to be massaged, but when I looked at it, I thought, I don't want to touch that. So rather than say that to them, what I used to do was say, look, it's looking a bit red and nasty today. I think we'll avoid that area. And I think that's wise, but without making them feel too embarrassed. And of course, if they didn't know they had them on their back because they can't see behind them, well, once again, you'd make them aware and just common sense and caution and looking after your client. The next one is any illness or disease that you know little about or don't understand. I always make sure that I get the okay from their treating physician or doctor and make sure that's okay to be massaged. That's just common sense, and I know you're pretty smart as it is, so that's okay. And any injury involving bleeding, I know you know this one off by heart, the rest, ice, compression and elevation, because we don't want to make it bleed anymore, do we? So yeah, and if someone rings up for an appointment and they've had a nasty accident, common sense to make them wait that 48 hours before any massage. All right, let's move on. Next one is a blood pressure. And if someone's got a history of blood pressure, it's advisable just to check that they're okay to be massaged. And as you already know, often massage is the best thing for them, especially if the blood pressure is caused through tension and stress. And that's what we're there for, isn't it? To relieve their tension, relieve their stress, and help them with their blood pressure. So yeah, and the other thing, of course, is the low blood pressure. If they hop off the table too quick, you know it's going to drop. So I'm sure you're aware, just to let them, tell them, advise them, sit up slowly, and if they feel dizzy, just pause for a moment. Well, I'm sure you're already doing that. Okay, broken skin. Yeah, avoid that, of course. We don't want to cause any infection. I also avoid any pimples that look like they're about to erupt, because we don't want to cause infection there either. Cancer. A lot of debate about cancer, and some say you shouldn't massage with cancer. Others say it's helpful. I always, if the client's uncertain, I always get them to check with their oncologist or their doctor. And often they don't mind either. Often if they're going through cancer treatments, and especially if it's a terminal illness, they would rather have the massage because that's going to help them relax, and that's their choice, you know. And if you're unsure, well, you may want to have a form that they sign to say that they understand that the massage is contraindicated, but they've decided to go ahead with it anyway. And I give an example there of a young 19-year-old. Her body was riddled with cancer, and she was only given 6 months to live. but did live for 18 months, and it was my absolute privilege and honour to look after her through that time with a regular massage and help her with the stress and all the treatments, and whether the massage prolonged her life or not, who knows. But it was, as I said, a real privilege to be able to be a part of that, part of her life, or the end of her life. So yeah, that's what my thoughts on cancer. Diabetes, as you know, massage is fine for people with diabetes. Apart from that, you know, that blood sugar will drop with the massage, so make sure they've got a snack or whatever they need to lift that sugar levels again at the end of the massage. And the second thing is, if they've got peripheral nerve pain, well then you know not to go too deep. I'm sure you already know that. Heart problems, and this depends on the problem. You know, if they've got blocked arteries or a weak heart, we don't want to put too much pressure by increasing that blood flow. So you need to be aware of that and just massage accordingly. The other thing with heart problems, you may find someone with a pacemaker. I'm sure you already know, just massage around that and they're fine. Hepatitis, just avoid that. You don't want to catch the infection or anything like that. So just avoid that. Infectious disease, once again. Although I have massaged people with severe flu or severe bronchitis, and it's up to you. Especially if they've got all this infection on their lungs. If they've got an infection on their lungs, like a bronchial infection, even if it's contagious, it was my choice to massage them. What I do, and I got to know clients over the years, is they would come and I would give them a pounding on their back and sometimes on their chest as well, which would help all the mucus free off their lungs, and they'd start coughing and spluttering and bringing it up, which really helped that area. But you need to know what you're doing. You need to have confidence when you do that, and your client also needs to have confidence in you. But that's something that I did successfully especially with clients that had regular bouts of bronchitis, and I found that really helped free the mucus off their lungs. Very beneficial. Okay, inflammation. Ice massage, as you know, is very helpful. So what I do is I'd massage around the area where the inflammation is, and at the end of the massage I would use ice massage. But one thing, as you go through my teaching with the cross fibre release method, often the inflammation is caused by tendons rubbing together or crossed over and rubbing together. And as you go through my teaching, if you're confident that you can get those tendons back where they should be without rubbing, which is causing the inflammation, and you can do it quickly and gently without causing too much more inflammation, then I would do that, because what I'm doing is relieving the cause of the inflammation in the first place, which means they would heal a lot quicker. But once again, you need to know what you're doing. You need to proceed very cautiously and very carefully. And if you're not confident, don't try that at all. Just stick with the ice massage, okay? But you'll find often, once you get used to the cross fibre release method, that you're able to release the cause of the inflammation. So that's a good one to know. Intoxication. Don't you ever massage someone when you're intoxicated, all right? And make sure you got no alcohol in your breath, because they won't come back. And yes, of course, if someone comes to you intoxicated, as you already know, it does numb the senses, so massage is certainly contraindicated. Joint dysfunction, if they've got dislocations anywhere that they usually dislocate, a history of that, you know, I'm sure you know, just massage around the area. Be very, very careful with that. You don't want to cause that joint to dislocate again. Neuropathy, very important. Look, anyone that can't give you feedback because their nerves are damaged in some way, you can't do any deep massage. Feedback is so important. In fact, what I do, if someone's on painkillers for pain at all, I advise them to cut down as much as they can, because pain gives you the feedback as to what's going on. How do you now know if you're making them better or making them worse if they can't give you the feedback? So just remember that one too. Osteoporosis, we already know about that. The weak bones, massage very gently. I don't think I need to say any more about that one. pain, discomfort or numbness that you know little or nothing about, once again, get them to check with their doctors and see if they're okay to be massaged. But you're experienced therapists, I'm sure you're already aware of that. Recent injury or surgery. I've had instances where I've been advised by the surgeon post-surgery to do some massage to get rid of the fluid around as a result of the surgery. So once again, check with their surgeon or doctor and definitely follow their instructions. Don't go and gung-ho by yourself. Rheumatism, mostly contraindicated, especially where the inflammation is concerned. But once again, if you're an experienced therapist around the joint and you can remove that inflammation from around the joint with your massage, well, you can proceed cautiously and gently. I use heat rub to start with and then finish off with arnica cream and ice if I needed it. But I've had a lot of success, especially with knees, getting rid of all that fluid and all that inflammation around the knees with my massage, and you'll find that in some of my teachings as you go through. So yeah, think about that one as well. Some medications like blood thinning, sure you're aware of that. They bruise easily, so just be careful with that one. Systemic infections, we need to be very careful with that one again. But as I said before, with the bronchial, I did those sort of things as well. Varicose veins, simple rule, the bigger they are, the gentler I massage. The smaller they are, the deeper I can go. Like, you already know that anyway. I don't need to tell you that. So you should know that one. And whiplash, and that's the last one on the list, and it's not the complete list by any means, but they're the most common ones. Whiplash, as you know, there's been many cases where people have had a severe whiplash, had x-rays and scanned and been cleared, only to find that there was a hairline fracture. So I can't emphasise enough, you need to find out how severe the whiplash was, and if there's any chance of a hair fracture, well then certainly proceed very, very cautiously and let pain be your indicator as well. So that's all from me with the contraindications. I hope that there's been some tips there. I know that you know them off by heart, but I just trust that some of my tips have been helpful and given you something to think about, and I wish you well with all your massage. God bless.